3 tips for treating brachycephalics. I'm Dr. Deere, I'm a small animal emergency veterinarian, and I treat a lot of brachys. Number 1 is do not be afraid of sedation. You can do this through PVPs or once they're already in the hospital. But if these guys get too excited and they pant a lot, they can get a lot of laryngeal edema. And I've seen Frenchies go into respiratory crises secondary to their excitement of being in the vet, or just their stress. Number 2 is do not forget that the airway and the stomach are joined. These guys are prone to things like aspiration pneumonia, reflux, hiatal hernias. So if I'm performing any surgeries on brachys, I make sure I've got a lot of things like kinetics and antiemetics on board. I've also taken to recovering these guys on like high flow oxygen. It just seems to lead to better outcomes. And lastly, have discussions with your brachy owners about sleep apnea. You will be shocked how many of them have some degree of it. There are some really good studies out there about using things like ondansetron, trazodone, and L-tryptophan for these guys that have sleep apnea. But if you don't ask, you'll never know. And as a fourth, not really a tip, make sure you talk to all your brachy owners about BOAS, and if you feel they're a good candidate for corrective surgery. BOAS is progressive, and so the sooner that you can intervene, the better the outcomes overall. You don't want to wait until these dogs are in a crisis to discuss this.